Hyperthyroidism, an overactive thyroid, occurs when your thyroid gland produces too much of the hormone thyroxine. Hyperthyroidism can accelerate your body's metabolism, causing unintentional weight loss and a rapid or irregular heartbeat. Graves' disease is an immune system disorder that results in the overproduction of the thyroid hormone. Although a number of disorders can result in hyperthyroidism, Graves' disease is a common cause. Thyroid hormones affect many bodily systems, so signs and symptoms of Graves' disease can be wide-ranging. Some research suggests that selenium can be used to treat the symptoms of hyperthyroidism. Selenium is a mineral and it naturally occurs in water, soil, and foods like nuts, fish, beef, and grains. In Graves' disease, selenium supplementation may lead to a faster remission of the hyperthyroidism and an improved quality of life, and eye improvement in patients with mild thyroid eye disease. The thyroid gland has the highest selenium concentration per unit weight among all tissues. Selenium is incorporated into key enzymes that are involved in several metabolic pathways. One way to get your daily requirement of 200 micrograms of selenium is to eat 3 Brazil nuts per day. Observational studies have found low levels of vitamin D in patients with hypothyroidism, which is underactive thyroid, as well as hyperthyroidism, the overactive thyroid, due to Graves' disease. You can get a 25-hydroxy vitamin D blood test and then take vitamin 3 accordingly to correct any deficiency. Test tube studies have found that lemon balm blocks the attachment of antibodies to the thyroid cells that cause Graves' disease. The brain's signal to the thyroid-stimulating hormone, is also blocked from further stimulating the excessive active thyroid gland in the disease. In vitro and rat studies of bugleweed and lemon balm extract have demonstrated anti-thyroidal effects. This is the first report of the use of these plant extracts in the treatment of 2 patients with Graves' disease, where it led to a restoration of the euthyroidism and the normalization of the TSI titers. Further study of the anti-thyroidal effects of bugleweed and lemon balm in humans is therefore warranted to evaluate its potential role as an adjunctive therapy in Graves' disease. You can purchase lemon balm as a tea or even add it to salads and many recipes. There's some evidence to suggest that the administration of vitamins with antioxidant properties in patients with hyperthyroidism can decrease the severity of the clinical symptoms. Vitamin C is a powerful antioxidant. Take vitamin C in the form of liposomal vitamin C or non-acidic vitamin C for best results. Don't use cheap, acidic ascorbic acid. Vitamin C works synergistically with bioflavonoids like quercetin that's found in elderberries. There's a link to hyperthyroidism and low magnesium levels. You should take magnesium in the form of magnesium bisglycinate. In order to determine your dose of magnesium, slowly increase until stomach discomfort or diarrhea is noticed. Then gradually reduce until you find the maximum tolerable daily amount of magnesium that you can take. As magnesium is required by hundreds of enzymes in the body, you may experience some profound results after a few months of supplementation. Another mineral that's required for the proper functioning of hundreds of enzymes is zinc. Low zinc levels have been observed in people with Graves' disease, as well as increase in zinc excretion. A more accurate way to test for zinc is by testing red blood cell content rather than serum levels. Recommended doses of zinc can range from 30 to 50 milligrams per day. Check the absorption of the various forms of zinc, as some have low absorption, some as low as 20%, meaning higher doses would be required to reach the required amount. Eye problems known as thyroid eye disease affect around 1 in 3 people with an overactive thyroid caused by Graves' disease. Problems can include eyes feeling dry and gritty and being sensitive to light. one of the most advanced eye formulations developed that contains lubricants together with a unique antioxidant called N-acetylcarnosine is Can-C eye drops. These are proven to soothe and to rejuvenate tired eyes, helping with macular degeneration, cataracts, and other age-related eye disorders. This could be an effective treatment to help to protect your eyes from thyroid disease. Omega-7 from sea buckthorn and astaxanthin are also good supplements to help to protect the eyes. For the highly stressed and strung out, herbs that have relaxing properties may be indicated. Ashwagandha, chamomile, passion flower, valerian and rhodiola may help to calm the body and the mind. Romania provides additional support to the adrenals. It reduces inflammation and it helps to modulate an unbalanced immune system. A B complex that includes all the B vitamins will help to support the body during times of physical and mental stress. It also plays a role in relieving anxiety and nervous tension. Feeling fatigued is a common complaint of people with Graves' disease, and supplementing with a B complex may help to relieve exhaustion and to provide support. Vitamin A is vital for healthy thyroid function, and a deficiency is common in people with thyroid disorders. In one study, the serum levels of vitamin A was significantly reduced in people with both over and underactive thyroid disorders. If you've hyperthyroidism, there's a good chance you've got a B12 deficiency. A B12 deficiency can leave you feeling fatigued, weak and dizzy. Be aware that a blood test can miss a B12 deficiency, as food is now fortified with folic acid, and this can mess with the reading of the blood test. If you can't get B12 injections, get a sublingual methylcobalamin 5000 microgram supplement. In a randomized trial, it was shown that 2 to 4 grams per day of oral L-carnitine was capable of reversing hyperthyroid symptoms and biochemical changes in the hyperthyroid direction, as well as preventing or minimizing the appearance of hyperthyroid symptoms. Typical doses of L-carnitine are 1 to 3 grams per day. Iron is a nutrient that's important for normal bodily processes, including the thyroid's health. Iron helps the red blood cells to carry oxygen to other cells in the body. Researchers have linked low levels of iron to hyperthyroidism. You should only consume food-sourced iron, as synthetic iron supplements have been linked to side effects. Findings show that hyperthyroidism increases the components of the antioxidant system in the erythrocytes, and furthermore, vitamin E supplementation reduces the burden of the oxidative stress in the hyperthyroidism. You should get a food-based mixed tocopherol source of vitamin E. Present findings reveal that omega-3 has encouraging therapeutic effects against hyperthyroidism-induced hepatic dysfunction. These effects of omega-3 are attributable to more than one mechanism: antioxidant, anti-inflammatory, and anti-fibrotic effects. Doses can range from 3 to 9 grams per day of a molecularly distilled EPA-DHA fish oil blend. Turmeric may reduce the frequency of thyroid disease. Studies have linked certain species, including turmeric and green chili, to reducing the frequency of thyroid disease, including hyperthyroidism. Common doses of curcumin, the turmeric extract, range from 2 to 5 grams per day. As curcumin has low absorption, it can be enhanced by taking it with biopterin, which is black pepper extract, or with an oil like butter, ghee, coconut oil, or fish oil. Glutathione is known as the body's master antioxidant. Glutathione recycling helps to balance immune function and to shield thyroid tissue from inflammation and autoimmune attacks. Glutathione also helps to repair damaged tissue, such as is the case with leaky gut. Some ways to increase glutathione levels are by taking reduced glutathione at up to 1 gram per day, taking 200 milligrams of S-acetylglutathione per day, taking the precursor N-acetylcysteine at 500 milligrams 3 times per day, taking the herb milk thistle or eating asparagus, and also ensuring that you have your daily dose of selenium, 200 micrograms, or 3 Brazil nuts. Folic acid is affected by thyroid dysfunction, as hyperthyroidism is associated with subclinical deficiency and depletion of folate stores. You might want to take folate in the form of 5-methyl tetrahydrofolate. For more information about the herbs or supplements mentioned in this presentation, check out my website.